Hello, it's me Tina Thomas, and with me I have Richa. Today we are going to do another role play. It's about a 10-year-old boy who is having vomiting and stomach pain. So the patient, I'm going to act as a role of a patient, and I'm going to be a mother, and Richa is going to take the role as a nurse. And the mother is very much concerned about her son who's having the stomach pain and vomiting. So we'll see how the nurse is going to address to the mother's concern and how she's going to emotionally support her. So why don't we start with the role play?
Absolutely.
Okay, so we get 3 minutes to prepare.
Yeah.
And can we start with the role play?
Yes, absolutely. I'm ready.
Okay, and your time starts now.
Good morning. My name is Richa. I'm one of the registered nurses working in this community health center. How may I address you?
You can call me Maria.
All right, Maria, I can see that you brought your child along with you.
Yes.
And you seem to be a little worried too. Is there anything worrying you?
Absolutely, nurse. See, nurse, this is my only child,
Okay.
and his name is Jim, and he's 10 years old. From yesterday night, I think around 12 o'clock, he started to have vomiting, and that was very bad vomiting. I think around 5 to 7 times he had
alright.
severe vomiting, and now he's not able to pull himself up. He's very tired, and he looks very drowsy too.
Okay.
Will you please have a look on him and tell me what's happening with him?
Absolutely. Don't worry about it. I know being a mother, this would be very difficult to see your only child having all these troubles. But don't worry, I've reached the right place. I will take it from here, okay?
Okay.
But before we get into further discussion, I need to ask you a couple of questions so that I can get an idea about what might be causing this problem for Jim.
Okay.
So could you tell me about when it started?
Okay, so as I told you earlier, it started from midnight. Like I put him to bed, and suddenly he called me and said, "Ma, I'm not keeping well." Instantly he throwed up.
Okay.
And again after half an hour, again he throwed up, and then he became tired. After 2 episodes of vomiting, we tend to become tired. Till morning he was having severe vomiting, and he was not able to wake up from the bed. And I think he's slight feverish too.
Oh, right. So that must have been very difficult for you,
Yeah.
right? So you told me that he has been throwing up a lot. And does he have any other symptoms like loss of appetite?
Loss of appetite. Actually, after this throwing up, I tried to give him some juices or some oral fluids, but no, he didn't take anything of those.
All right.
And then he's having severe pain in his stomach.
Okay. Did you try giving him any pain medication?
I did give him a small pain medicine, or an oral syrup I gave him, but it didn't work, nurse.
All right. Okay. And you told me that he is having vomiting. Does he have any episode of diarrhea?
No diarrhea, just vomiting.
Oh, right. And he's feeling tired, right?
Very much indeed.
Okay. So does he complain of lightheadedness or uneasiness or any bloating?
Today morning he was telling me he's having headache, so I told him it might be due to this vomiting, but he doesn't sound good, nurse.
All right.
Has
okay.
he caught any virus or any fever or any cold or something? I really have a doubt.
Okay, I understand that you are really worried and
Yes.
there are a lot of concerns for you. Well, before I give you my suggestion, I need to ask you one more question so that I can get a clear idea about
No
what
problem.
might be causing
No
it.
problem.
Since he's having diarrhea and vomiting and things like that, it might be something related to the food he has eaten. So could you tell me about his normal eating habits?
Well, actually he's a little fussy person when it comes to eating food. He prefers a lot of takeaway foods.
Okay.
But recently, for past many days, he's been eating from our place. Yes, yesterday we had a party, and like we all had food
Alright.
from there. Other than that, nothing else.
So was he eating a lot of food yesterday?
No, he has his own minimal amount of food, but yes, he did take. There were a lot of fries and stuffs, right? So he was eating much of that.
Okay. Did he mention about trying something new yesterday, like some food which he has never tried before?
It's a party, right? So there are a lot of dishes being served. I don't think I watched what all he ate, but yes, he said the food was yum and tasty.
All right. Okay.
That's one.
All right, thank you very much for giving all the information. So I think I got the relevant details for the time being. So from the discussion and the symptoms which he is experiencing, I think he might has got a food poisoning.
Food poisoning?
But there is nothing to be worried about. It's quite common because sometimes when we eat contaminated food or water, it might cause food poisoning. And well, I'm not very sure about what might be the exact cause for the reason why he's experiencing this at the moment. But since you told me that there was a party yesterday, he might have tried something new and...
But can I just interrupt you,
Sure.
nurse? The thing is, we all were there for the party.
Mm-hmm.
I had the same food, my son had the same food, my husband had the same food. How come he only got food poisoning and how come we never got food poisoning?
That's a very reasonable query from your side. Listen, when the person eats food, it totally depends from one person to another. So your body metabolism will not be like of your child. So that's the reason why he might be experiencing all this problem and you are not. And you told me that he started to experiencing this for the first time and yet from yesterday night, right?
Yes.
So you had the party yesterday too. So the possible reason why he's showing all these symptoms might be because of the party.
Okay.
So that's the reason why I told you this too. But since it is related to the food, I can tell you some measures how we can overcome this.
Please
Okay.
do tell me, nurse.
So it is very important that he drinks a lot of water to keep himself hydrated. And for the time being, we have to avoid any usage of coffee. Does he drink a lot of coffee?
He doesn't.
He doesn't. Okay, well that's good then. And make sure that he hold off on any solid food until his vomiting and diarrhea, submisses. Okay? And make sure that you give him simple to digest food. You can give him ripe bananas or boiled vegetables or fruits for the time being. Okay? And just for the time being, I would like to tell you that please be cautious about what he eats. I know that you're a good mother. I'm not saying that you're not paying attention to him, but still he's just 10 years old. He can just go around and eat anything.
I can understand that.
Yes, so just watch out and make sure that he eats the food which is under your observation.
Yes,
Okay?
yes.
So that being said, I hope I have clarified everything for you. Do you have any concerns?
No, nurse, you have been very supportive and you have been very cooperative to us, and thank you so much for the time.
No problem. And again, if you have any concerns, you can reach out to me and I'll be happy to help you with that. Okay?
Okay.
All right,
Yes.
thank you very much for your time.
Yes. So we have come to the end of our role play. Again, another role play has been done. This is again a role play regarding
Yes,
a little boy who's having stomach pain and vomiting, and as the nurse has diagnosed him with food poisoning. So 𝗪𝗏 has done again a good job over there by telling the mother that see, this is not
Yes.
it's a small problem. There's a lot of treatment for that, and she gave a lot of valuable advices on how to reduce this vomiting and how to overcome from this food poisoning.
And especially in this cue card, we have a task where we are actually telling the mother to be cautious.
Cautious, yes.
So when you do that, it is a very tricky one because when the parent can actually retaliate back to you by saying like so you're saying I'm not a good mother.
Yeah, you're questioning my responsibility
of a
yes.
mother. So
yeah.
it can be very difficult and tricky. So when you do that, be very conscious and very tactfully you have to convince the parent there. Okay.
Yes.
So we will get into the discussion part about how we can pick the keywords and create sentences. So stay tuned. Hello everyone, we just saw a video where you're talking to a concerned mother. She's worried about her 10-year-old boy who is having continuous vomiting and severe stomach cramps. So she is really worried whether he might have contracted something serious. So let's see how we can create the sentences, picking up the keywords. Let's get into the video. The first one, begin with warm greetings and ask for the purpose of visit. It's easy, right? We normally do this in almost all the role plays, so there is nothing much to explain there. As normal, you can do like good morning, and then you can introduce yourself, you can greet the patient, and then you can ask what is the reason for their visit. So I hope you guys already know that. So you can simply say, good morning, my name is 𝗪𝗏. I'm one of the registered nurses working in this community health center. How may I help you? As simple as that. Second task, acknowledge the concern and offer to help. So here I actually want to tell you to separate it into two segments because it is clearly mentioned in the cue card to acknowledge the concern and then offer to help. So what happens normally is that students rush into the second part, offering to help. Don't worry, I'll look into it. So before that, there is a parameter which is mentioned, acknowledge the concern. So you need to make sure that you provide emotional support there before rushing into the second half of task number 2. So here the keywords are acknowledge the concerns and offer to help. So you can create a sentence by saying, I understand it is a difficult time for you, but don't worry, you have reached the right place, I will look into it. That is how you can complete the sentence. So there you're actually providing emotional support by saying that you have reached the right place, and then you're saying, I will look into it, that is offering the help. So you can provide a good support as well as you can offer the help together in a particular sentence. So that's how we do task number 2. Now let's look into task number 3. Gather information, onset, frequency, other symptoms, loss of appetite, diarrhea, dizziness, lightheadedness, malaise, bloating, etc. So there are a lot of details given here. So we cannot simply say the keyword here is, finding out information, but actually the information which is given in the bracket, all those has to be covered here. So let's look into how we can create a sentence using these points. So you can say, I understand that you're having a difficult time right now, but I would like to gather some information so that I can help you better. Then you're getting into it. The first thing you can ask is when it started. Then you can ask about the frequency. You can ask a question like, so how many episodes of vomiting? Or you can ask a question like, could you tell me how frequently he vomited? Then you can ask about other symptoms. So when you get into other symptoms, you can ask a question like, besides the symptoms you already mentioned, does he experience anything else? Like loss of appetite, diarrhea, dizziness, lightheadedness, uneasiness, bloating. So this is how you can cover it. So do not ask all those information together because the mother, that means a concerned mother, may not be able to respond to everything because she might not be able to pick out each and everything that you just asked. So do not clap everything together, break it down and maybe ask it in 3 or 4 questions. So that's how we can do task number 3. Now let's look into task number 4. Try to find out about his eating habits, pattern, preferences, eaten anything from outside. So it's easy, right? The keyword here would be eating habits. So let's see how we are going to create a sentence using this keyword and including the information given in the brackets. So the sentence can go like, I would also like to know about his eating habits. And then you can mention, could you tell me about his eating pattern? What are his preferences? Has he eaten anything from out lately? So these are the 3 questions you can ask here. Let's look into the next one. Inform the parent the symptoms are suggestive of food poisoning and its causes, contaminated food and water. So here the keyword could be symptoms suggestive of food poisoning and causes. And the information about causes, it is given in the brackets, so you have to obviously include those. So let's create a sentence there. Based on our conversation, I can see that the symptoms your son is experiencing are suggestive of food poisoning. I know it comes as a shock to you, but don't worry, it is totally manageable. The possible causes of food poisoning can be contaminated food and water. So this is how you can complete this particular statement. Let's look into the next one, that is a 6th task. Offer measures to overcome hydration, avoid caffeine, hold off on solid foods until vomiting and diarrhea have passed, use simple to digest food. So what is the keyword here? Overcome. That is the first keyword, and as usual we have to mention the points which is given in the bracket. So each and everything has to be slightly mentioned. So let's see how we can put all this together to create a sentence. Please make sure that he drinks a lot of water because it is important to keep himself hydrated. And make sure that if he has the habit of drinking a lot of coffee, avoid caffeine for the time being. Hold off on solid foods until his vomiting and diarrhea have passed. And also make sure to give him simple to digest food. So you have covered all the information here. So this is how you can pick the keywords, connect it and make a sentence. Easy, right? So let's see how we can do the next one too. Advise mother to be cautious about what he eats and drinks in the future to avoid such incidents. This is actually a pretty tricky one because we're actually telling a mother to be more conscious about how she takes care of her own son. So some patients might not be very happy to hear that, right? So if someone is talking about our son and how to take care of our son to us, we won't be happy to hear that. It will make us feel like we are not a good mother. So when you actually tell this to a mother or a father in any case like that, about they need to be a little more cautious about taking care of their son or daughter, you have to be very careful. Your sentence construction has to be tactful. It has to be polite and emotionally supportive as well. Okay, do not make them feel bad. So here the keyword would be cautious, what he eats, drinks. So let's look into this sentence. There is no doubt that you are a good mother, but since your son has got food poisoning, please make sure that you're cautious in the future about what he eats and drinks. Just keep a watch on him. A simple sentence where not hurting the feelings of the mother. So this is how you can tactfully convince her. So that's all about this particular cue card. I hope this was helpful for you guys. So practice yourself by picking the keywords, connecting it and creating the sentences. For more tips like this, keep watching the videos from IILT and subscribe to our channel and post your valuable comments and suggestions. We'll definitely look into it. Thank you so much for watching.
IILT, it's my cup of tea.